One simple checkup after 70 can start a chain you never wanted. Before you book your next test, hear this. It could help you or quietly harm you. If you want clear, science-based senior health tips like this, hit subscribe right now. You will get simple steps you can use the same day, not scary headlines. And if you stay to the end, you will have a safer, smart checkup plan. I am not here to tell you to never see a doctor. I am here to help you avoid low-value tests. Low value means the risk and stress can outweigh the benefit. After 70, that balance can change fast. Your body is wise, but it also recovers slower. So a test that was routine at 55 can be risky at 75. Have you ever done something just in case and it caused more trouble? Quick medical note before we go on. This video is for education only, not personal medical advice. Only your clinician can weigh your health, symptoms, and history. If you have new pain, bleeding, weakness, or sudden shortness of breath, get care fast. Now tell me this in the comments so I can tailor future videos for you. How old are you, and what state or country are you watching from? Just type your age and location. It helps build a stronger community for seniors. Let us bust a big myth first. Myth. More screening always saves more lives. Reality. Sometimes screening finds a real cancer that would never hurt you. That is called overdiagnosis. Overdiagnosis can lead to surgery, radiation, pills, and fear you never needed. A 2023 study from Yale School of Medicine found that in women ages 75 to 84, about 47% of breast cancers found on screening were estimated to be overdiagnosed, and there was no clear drop in breast cancer deaths from continued screening in that group. Does that shock you? Almost half could be real cancer, yet not a real threat. Now let us do the reverse countdown. These are 5 health checkups you may want to avoid after 70, unless you have symptoms or a strong risk reason. You will also get safer options and simple steps. Ready? Let us start at number 5. Routine carotid ultrasound screening when you have no stroke symptoms. Number 5 is carotid ultrasound, just to check the neck arteries. Misconception: if they find a blockage early, they can prevent a stroke. Reality: for most people with no symptoms, this test can create false alarms. False alarms can lead to more scans, more procedures, and more anxiety. It can be like pulling your smoke alarm off the ceiling and shaking it daily. You might find dust, but you also might break something. A 2024 study from Weill Cornell Medicine found that among 150 patients who got carotid ultrasound, 51% were labelled low value by a claims measure, and 42% were low value by chart review, showing a lot of tests may not be needed. So what should you do instead? Step 1. Ask your clinician one clear question. Do I have symptoms or a past event that makes this test useful? Symptoms can include one-sided weakness, face droop, or speech trouble. Step 2. Focus on stroke prevention that helps almost everyone. That means blood pressure, walking, sleep, and food. Step 3. Ask if you should be on a statin or not, based on your risk. Here are food steps with exact amounts. Aim for 25 to 30 grams of fibre each day. If that sounds hard, start with one change. Eat 1 cup of cooked oatmeal at breakfast for soluble fibre. Add 1 tablespoon of ground flaxseed for extra fibre and healthy fats. Try 1 cup of beans 3 times a week, like lentils or chickpeas. And eat fatty fish twice a week, about 3 to 4 ounces per serving. That can support heart and vessel health. Do you see how food is a daily checkup you control? Mid-roll question for you. Have you ever been sent for a just-in-case scan that turned into more tests? Type yes or no and tell me what test it was. Now here comes number 4, and it surprises many people. Routine thyroid ultrasound screening, when you have no lump and no clear reason. This is when someone scans your thyroid just to be safe. Misconception: finding thyroid cancer early always saves you. Reality: many tiny thyroid cancers grow so slowly, they never cause harm. But once you hear the word cancer, it can push you into surgery. That can mean lifelong thyroid hormone pills. It can be like catching a tiny scratch on your car and replacing the whole door. A 2026 study from the University of Wisconsin-Madison estimated that between 72% and 94% of papillary thyroid cancers diagnosed in the US from 1991 to 2019 were overdiagnosed, meaning they did not affect mortality. That is a massive range. but the message is clear. More scanning can mean more cancer labels, not always more saved lives. So what should you do instead? Step 1. Use your hands and awareness. If you feel a new neck lump or have new trouble swallowing, get checked. Step 2. Ask for a focused exam first, not a scan first. Step 3. If a small nodule is found, ask about watching it over time. That is called active surveillance, meaning careful follow-up, not panic. Food steps with exact amounts, kept simple. Do not self-dose iodine pills unless your doctor tells you. Too much iodine can be harmful. Instead, use normal food sources. Eat 1 cup of plain yogurt for iodine and protein. Or have 1 to 2 eggs a day if that fits your health plan. Include selenium foods for thyroid support, but keep it modest. Try 1 Brazil nut per day, not a handful, because selenium can build up. And drink water, because dehydration can make you feel weak and foggy. Have you ever noticed how a small pill choice can change your whole week? Transition hook, because number 3 is even more common, and it can bring real complications after 75. Routine screening colonoscopy after 75, especially when you are frail or have other illnesses. Let us be clear. Colonoscopy can save lives in the right person, but after a certain age, the risks can climb. Misconception. If I stop colonoscopy, I am giving up. Reality. Sometimes the safer choice is a different test, or stopping. It is like climbing on your roof to clean leaves at 85. Yes, the gutter matters, but the fall risk matters more. A 2020 study from the University of Toronto and McMaster University found that adults aged 75 and older had a 6.8% rate of hospitalization or emergency visits within 30 days after outpatient colonoscopy, compared with 2.6% in ages 50 to 74. They also reported higher bleeding and heart-related admissions in the older group. That does not mean never do it, it means choose carefully. So what should you do instead? Step 1. Ask your doctor about your goal. Is this colonoscopy for routine screening or for symptoms? Symptoms like blood in stool, new anemia, or major weight loss are different. Step 2. Ask about stool tests as an option. Many people can use FIT, a stool blood test, each year. Step 3. Ask how long it takes for colon screening to pay off. Some benefits take many years, and you deserve that truth. Food steps with exact amounts for colon health. Aim for 25 to 30 grams of fibre per day. Add 1 medium pear or 1 medium apple daily for about 4 to 6 grams. Eat 1 cup of raspberries for about 8 grams of fibre. Have 2 tablespoons of chia seeds in water or yogurt for about 10 grams. If that is too much at once, start with 1 tablespoon. And drink an extra 2 cups of water when you increase fibre. Otherwise, you can get constipated. Does it not feel better to build health slowly instead of betting on one big test? Mid-roll like button moment. If you want more smart checkups that respect your age and safety, tap like. It tells the platform to show this to more seniors who need it. Transition hook number 2 is emotional for many families, and the data is eye-opening. Routine screening mammograms late in life without a life expectancy and risk talk. This is a sensitive topic. Mammograms can reduce deaths for many women in midlife, but after 70, the math can shift for some women. Misconception. If I keep screening forever, I will be safer. Reality. You may be more likely to be treated for a cancer that would not harm you. That can mean surgery, radiation, and months of stress. It is like setting a fishing net in a pond. You may catch a fish, but you may also catch a turtle you never meant to hurt. A 2023 study from Yale School of Medicine found overdiagnosis estimates of about 31% for women 70 to 74, 47% for women 75 to 84, and 54% for women 85 and older, with no clear reduction in breast cancer deaths from continued screening in that study. Also, the National Cancer Institute explained that if screening finds more cancers, but deaths do not drop, that pattern can signal overdiagnosis. So what should you do instead? Step 1. Ask for an honest benefit-harm talk based on your health, not just your age. Step 2. If you have a strong family history or genetic risk, your plan may differ. Step 3. If you choose to keep screening, ask what you would do with a small finding. Would you want aggressive treatment or careful watching? It is your body, and it is your choice. Food steps with exact amounts that support overall health and may lower cancer risk. Aim for 5 servings of plants daily, even if they are simple. Have 2 cups of leafy greens per day, like spinach or romaine. Add 1 cup of broccoli or cauliflower for fibre and vitamins. Get protein at each meal to protect muscle. Try 25 to 30 grams of protein at breakfast, like 1 cup of Greek yogurt plus nuts. Limit alcohol, because even small amounts can raise breast cancer risk for some people. Would you rather spend your energy on daily strength or on extra appointments? Mid-roll story share moment. Share a short story in the comments. Have you or someone you love had a screening that led to treatment, then regret? Your story may help another person choose wisely. Transition hook, and now number 1, the checkup many men get without even asking for it. Routine PSA blood tests for prostate cancer screening after 70, without a real risk-benefit talk. This is the PSA test. It is often added to labs like it is harmless. Misconception. A PSA test is just information. Reality. A high PSA can be a false alarm. Then you may face biopsy, infection risk, and months of worry. Some cancers found grow so slowly they never threaten your life. It can be like a car warning light that turns on for a loose gas cap. You start replacing expensive parts for no reason. A 2023 study from the University of California, San Diego, found that among 32,306 men aged 70 and older, recent PSA screening rates were still very high, including about 55.3% in ages 70 to 74 and 39.4% in men 80 and older. The key point is not PSA is evil. The key point is that many older men are still being screened, even when benefit is unclear. So what should you do instead? Step 1. Ask if the PSA is being ordered for screening or for symptoms. Symptoms can include bone pain, weight loss, or urinary changes that are new and severe. Step 2. Ask about your life expectancy and your treatment goals. That sounds heavy, but it is honest medicine. Step 3. If you do test, ask what number would trigger a biopsy. Some men choose repeat testing first to avoid rushed decisions. Food steps with exact amounts for prostate and overall health. Add tomato-based foods a few times per week. Try 1 cup of cooked tomato sauce or 1 cup of tomato soup. Add 1 ounce of pumpkin seeds for zinc and healthy fats. That is about a small handful, not a bowl. Choose 2 cups of green tea daily if it is safe with your meds. If you take blood thinners, ask your doctor first about supplements. And keep strength training twice a week to protect metabolism and hormones. Would you not rather control what you can instead of chasing lab fear? Now we need the serious warning part, because avoid does not mean ignore. Some tests are low value for routine screening, but high value when you have symptoms. Call your clinician fast if you have warning signs like chest pain, sudden weakness, fainting, black stools, coughing blood, or sudden vision changes. Also be careful with test chains, because one test can lead to another. A scan may lead to contrast dye, which can stress kidneys. A biopsy may cause bleeding or infection. Sedation can raise fall risk for some older adults, and medicines can interact in surprising ways. For example, blood thinners can increase bleeding risk after procedures. Some blood pressure pills can affect dizziness after sedation. If you have diabetes, fasting before a test can cause low blood sugar. So always tell the clinic your full medication list, including herbs. And ask this simple question before any procedure. What is the plan if this is positive? Now let us turn this into a practical daily routine you can actually follow. You do not need expensive gadgets. Start with a 3-check daily plan. First, walk 10 to 20 minutes after 1 meal each day. That helps blood sugar and blood pressure. Second, eat a protein anchor at breakfast, like 25 to 30 grams. That can be 2 eggs plus yogurt or tofu plus oats. Third, do a 5-minute balance drill near a counter. Try heel-to-toe walking or standing on 1 foot with support. Add budget-friendly foods that work. Buy frozen vegetables because they are cheap and still healthy. Buy canned beans, rinse them to cut salt. Buy canned salmon or sardines for omega-3s at low cost. Drink water and set a simple goal like 6 to 8 cups daily. And schedule 1 med review each year with your pharmacist or clinician. That review can prevent side effects that look like new disease. Is it not wild how often the real problem is the medicine mix? Let us wrap it up with a simple summary you can remember. After 70, some routine screenings can cause more harm than help, especially without symptoms. We covered 5: carotid ultrasound, thyroid ultrasound, routine colonoscopy after 75, mammograms late in life, and PSA screening after 70. Your first action step is this. Before your next checkup, ask one question out loud. What problem are we trying to prevent, and what is the downside? That one question can save you months of stress. If this helped you, hit like and subscribe, because the next video will show the 5 checkups you should keep after 70. And remember my sign-off, because you deserve to hear it every day. Stay healthy, stay strong.